This is Alpesh Doshi here. I'm the clinic director and a consultant embryologist and a founder at IVF London. Today, I'm very privileged to give you a clinic tour of IVF London and exactly what we do and explain our journey in your care at IVF London. So we enter the clinic here, and this is the main entrance. This is our waiting room, and some of you may have seen our very famous baby tree, which is just here on the side, whereby we're very proud to put the pictures of all of our babies that we have helped create. And one of our true miraculous jobs is to help as scientists in reproductive medicine to make your dream come true of parenthood. So here we enter the waiting area, and this is the waiting area at IVF London where patients are they're met and greeted. And as you can see, it's a very well-lit room. It's got a very private feel. It's very non-clinical, and this is very important to us to make you feel comfortable and to make you feel as at ease as possible. So we then come to our phlebotomy room, which is where all the blood collection happens, and usually patients are having their bloods and scans done, typically on the mornings, every morning, and a quick blood collection from the patient happens in this room. Then we have what we call the Zen room, which is a very private room whereby patients are taken through their journey, what the journey involves, an explanation being given by your doctor, by your embryologist, or even the finance lady. So it's a very private room whereby you can sit and enjoy a discussion in private. It doesn't need to be had in front of all the patients or other patients who are waiting. So this is our little Zen room. We do use this room to even show you the journey of your embryos. We use a lot of artificial intelligence in the clinic, and we're capturing videos of developing embryos all the time. And before your embryo transfer, you will have the opportunity of seeing your embryos live on the screen here, and we're going to be running you through the various artificial intelligence algorithms that we use to select the better embryo for transfer. So moving on from the patient waiting area, and we have another baby tree right at the other end. So you can see that we have genuinely helped many couples get pregnant. And then we move towards the rest of the clinic here. We have a ultrasound room whereby we carry out all the follicle tracking ultrasound. As many of you may know, an IVF cycle, or the journey of an IVF cycle, does involve quite a few ultrasound scans and blood tests. And typically when a patient is going through an IVF cycle, there is about 4 or 5 ultrasound scans that are part of their IVF journey. And that's why it's very important that patients have a quick ultrasound, their blood test, and then they're able to get on with their normal working day. This is where the ultrasound happens. You can see that we have a 3D ultrasound machine there. We're quite privileged to have state-of-the-art equipment when it comes to ultrasound machines, whether that's even equipment in the laboratory, and we're going to have a brief look at the laboratory as well, and I'm going to be able to explain to you all the equipment that we use even in the laboratory, which is very, very cutting edge. We now enter our recovery area where the patients are, they recover after the sedation process. So typically in a IVF cycle, there is an egg collection involved, which does involve the use of certain sedatives or anesthesia. And after the procedure, the patient needs to recover for a couple of hours before they're able to go home after the procedure. So typically after the egg collection, they will be relaxing here for about an hour or two so that they are fully recovered post-anesthetic or post-sedation before they go home. So this is the, it's a 3-bedded area, and this is our recovery area. And yeah, we use it mainly for recovering patients post-sedation. We have 3 consulting rooms, and we've got Dr. Aarti here, who is just finishing a consultation online and documenting her notes. So we've got 3 consultation rooms whereby patients are seen. We do carry out consultations virtually as well as in person. So whatever the preference is, whether you wish to be seen by your consultant in person or whether you want to have a virtual consultation, all that is possible as well. So we've got another. Hello. We're just taking a brief video. So this is another consulting room. And this is Dr. Fatoum here and our nurse Sabrina, who are just discussing a patient's treatment. And we do have a very personalized treatment plan whereby we discuss all the patients who are going through an IVF cycle. We look at their ultrasound scans. We have a clinical review meeting 3 times a week so that we can decide on their upcoming treatment, how to modify the treatment, whether the treatment needs any kind of change in terms of optimizing the dose of the stimulation. And that's why it's a very multidisciplinary approach that we have here. So this is one of the consulting rooms whereby we do carry out such consultations and the clinical review meeting. It is also equipped with an ultrasound machine here, which you can see on the side there, so that the consultants are able to carry out an ultrasound straight after a consultation if required. Hello. Ooh. This is our nurse consultation room, and this is where a lot of the nurse consultation takes place. So some of you may know that, again, the journey of an IVF cycle does involve a lot of nursing care as well. So the nurses take a huge role in an IVF cycle of a patient, whereby a lot of instructions on how to take your medications, how to take your injections, making sure that the correct consent forms are filled. All this is part of an IVF journey. And for that, a nurse does handhold your journey very, very closely. They give you a lot of instructions on how to administer injections. All the do's and don'ts, everything would be explained to you in your nurse consultation, and that takes place in this room. We now go into the clinical suite, and this is where generally the procedures that happen beyond these doors are the surgical procedures or the clinical procedures. So this is our kind of clinical lobby, which connects the operating theaters or the main theaters. And again, you saw the recovery area earlier on. This is our operating theater. So you can see that the operating theater is equipped with a lot of high-tech equipment, including an anesthetic machine here, which we make sure is used on every patient going through sedation. It makes sure that the patient's vitals are being monitored throughout any kind of anesthesia procedures that are done. And although the procedures that we do in IVF are short-acting in terms of anesthetic or sedation perspective, we have an anesthetic machine here on site to give you that added level of safety and reassurance when any kind of sedatives or anesthesia is used. We then go into the main laboratory, and you can see one of the other equipment that we have here is called a IVF chamber, or it's a closed working chamber technology. This is what the embryologist uses to collect the eggs. So this is the room in which the egg collection takes place, and whilst the egg collection is taking place, the embryologist is screening the follicular fluid to identify the eggs, isolating the eggs, collecting the eggs, and taking them into the embryology lab to fertilize the eggs with the sperm. So now we enter the heart of an IVF unit, which is the laboratory or the embryology lab. And this is where I belong, because I do a lot of my work as a consultant embryologist in this little room here, which is not so little, but it gives me an opportunity to go through with you the various different technologies that we use in the IVF cycle to optimize your chances of getting pregnant. Now, you may hear a lot of background noise in this room. That is because we've got very high-powered air filtration systems that are keeping the air in the laboratory and theater continuously renewed. So by regulation and by standards, by regulatory standards, we need to have a very high-class air filtration system in the laboratory, because the embryos that are developing in the lab do require a very clean air atmosphere in order to breathe. because the air that the embryos are breathing has to be of a very high standard and very low in contamination. If the air is contaminated, the embryos will struggle in development and may not reach their true potential of giving a pregnancy. So this is the embryology lab, and as you can see, there's a lot of equipment in this room. Typically, again, as I mentioned earlier, this is the IVF chamber, and we work within the chamber for two main reasons. One, to protect the integrity of the eggs and embryos. The material that we're working with, i.e. eggs and embryos, are very temperature sensitive. So in order to preserve the integrity, and by the way, embryos and eggs are microscopic. You can only see them under a microscope. They are tiny. And because they are such tiny cells, they need to be treated with a lot of care and attention. And one of the ways we provide them with this very natural care and ideal conditions is by providing the temperature around the embryo at around 37 degrees, because that is the body temperature, and that is the temperature that the embryos are constantly wanting to be under. So that's why we use chambers like this, which is not routinely used in any other IVF clinics, but we have adapted to this closed working technology in order to make sure that the eggs and embryos are constantly under physiological conditions and there is very little trauma that the embryos face. We then have these Class 2 air cabinets, and the embryologist would be working in these cabinets looking down the microscope. Again, the idea being that the air within these cabinets is continuously filtered, cleaned and renewed, and is giving what we call a grade A, an air environment, so that the embryos are constantly having purified air to develop and grow. Apart from all the other technologies that we have, we also have a very strong level of technology for keeping the identity of your eggs and embryos very specific. One of the questions we often get asked is, how do I know that those eggs are mine? Or how do I know that those embryos are mine? It's a very, very valid question, and trust me, every patient has this question that, are those embryos mine? Have they been derived from my eggs and my sperm? So today I want to introduce you to the technology which helps us make sure that we offer you the safety and security in making sure that those eggs and embryos are yours. We use a procedure called electronic witnessing, and we use certain tags called RFID tags which go on dishes of your eggs and embryos and even your sperm tubes. So every time a sperm sample is produced or an embryo dish has got eggs and embryos in it, they will be tagged with the RFID tag. It's called electronic witnessing, and we are very privileged to have this electronic witnessing system in our lab, right from the front end of the clinic to the back end of the clinic, which processes your eggs and embryos. And we have screens like that you see in the chamber here, which give us the ability to log in and use the RFID tags to make sure that there is absolutely no mismatches of any eggs or sperm, and giving you the added reassurance and confidence that those embryos have been derived from your eggs and from your sperm, reducing the risk of error or any kind of adverse incident. We then move on to this piece of equipment here, which is called the embryoscope, and one of my colleagues may have already introduced this piece of equipment, but this is the incubator in which your eggs and embryos are being cultured. And whilst they're being cultured, we're continuously running AI on it so that images of your embryos are being captured as they deliver. And whilst every 15 minutes of culture is capturing an image, there is a long video that we can run for patients whereby we can select the right embryos that are developing. So you can see here that whilst the embryos are developing, we are able to see how they are doing in terms of time. And it's very, you can reel the videos from various stages of the eggs once they have been inseminated. So you can see a 2-cell embryo, a 4-cell embryo, an 8-cell embryo, and potentially even a blastocyst. But by looking at these various time patterns of the developing embryo, it gives your embryologist a lot of information about which embryos are more likely to achieve a pregnancy. So we now move on to this equipment here, which is called a micro manipulator. And this is the equipment that we use to fertilize the eggs or even carry out certain very highly skilled procedures like embryo biopsy. So let's go first to the procedure that I said earlier, which is to fertilize the eggs, which is called ICSI, intracytoplasmic sperm injection. So what we do with ICSI, typically 50 to 60% of the cases that we treat in an IVF clinic are male factor infertility, whereby the sperm count is low and cannot achieve normal fertilization if subjected to eggs without any intervention. So talking about intervention, what we need to do is we need to isolate and identify each single sperm and pick the single sperm up in a very tiny needle, which you can see there at the top of the microscope there. And that needle will be used to inject the eggs. Each egg would be injected with a single sperm to achieve fertilization. So this is the very high-tech microscope. It's called a micromanipulator and can be used for procedures such as ICSI and embryo biopsy. Talking about embryo biopsy, you may have heard of procedures called pre-implantation genetic diagnosis or pre-implantation genetic testing, which relies on taking a small biopsy from the embryo in order to test whether that embryo is genetically healthy or whether it is genetically faulty, which is a technology which is very revolutionary, that you can select embryos for many inherited genetic disorders, including disorders like cystic fibrosis, beta thalassemia, some inherited cancers like breast cancer, eye cancer, and so on. So there are many genetic conditions that you can now test the embryos for. So couples can embark on this journey without the fear of knowing that they are carrying a pregnancy that is healthy and free from the genetic disorder that they potentially were worried about. We then move on to incubators like these, which are called benchtop incubators, which typically have the axis that you can see there, and dishes are kept within this incubator chamber to develop overnight. We have more such incubators here. So we've got 2 more benchtop incubators in this lab. And as you can see, we have plenty of space within the laboratory as well. It's not a crowded lab at all. We're catered towards making sure that there is absolute safety during your treatment cycle, that there is no risk or potential concern that your embryologists, whilst they're working in the laboratory, may have an accident whilst carrying your dish. So it's a very well spaced out laboratory, and the embryologists that work in the laboratory are always very cautious about their movements so as to ensure that we really minimize the risk of any accident. We have further incubators here as well. We now enter an area which is the andrology lab. In this room, there is a standard cabinet where we process the sperm, but we also have centrifuges which helps us isolate the more motile sperm. So what happens is when we get a sperm sample, we let it stay here for about half an hour so it's liquefied, and then we start processing the sperm and extracting the motile sperm out of an ejaculate so that we can use that in fertilizing the eggs. So that is the embryology laboratory, and I hope you're able to see what exactly we do in the lab and specifically the magic that happens behind the scenes in the laboratory. We will now show you the embryo transfer room, and as you can see, both the embryo transfer room and the theater are connected to the embryology lab. Now this is very important. You may have even known or seen that there are some clinics that are spread on different levels. Now there's always a compromise when the laboratory is not on the same level as the theaters and the embryo transfer room, because ideally these 3 areas, such as the egg collection room or the theater, the laboratory and the embryo transfer room are best connected together, because the journey from collecting the eggs to transferring the embryos is a very sensitive journey, and it really needs to be minimized in terms of any risk of accidents or adverse events. So you can see at IVF London, both the egg collection and the embryo transfer room are connected to the main laboratory. And here we go into the embryo transfer room. And this is where our embryo transfers happen. Again, we're fortunate that we have quite a few ultrasound machines in the clinic, and we perform our very vital procedures such as embryo transfers under ultrasound guidance. Research has shown that when embryo transfers are done with ultrasound guidance, the pregnancy rates are much higher. And that's why it's very important to make sure that the techniques and technologies that we use are validated and research backed. And one thing we're very proud of here at IVF London is we use the optimum technology, the best technology and the best equipment when it comes to your IVF cycle. So this is where the embryo transfer happens. That's the ultrasound machine which is used to perform the embryo transfer. We now go out into the lobby again from here, and I'm just going to quickly show you the small room where we keep all the medical gases. Now this might scare you a bit, but again you can see the number of cylinders that we have in this room, and the gases range from carbon dioxide to nitrogen to medical grade oxygen. These are very important in the care that we deliver, because all the incubators that we run and even the anesthetic machines that operate all work on medical gases. So for example, in the laboratory, we need carbon dioxide, we need nitrogen in order to run the incubators, and in theaters, we need medical grade oxygen to keep the patient ventilated during the anesthesia. Now, the other thing I wanted to add is we have some very sophisticated equipment in the laboratory which safeguards your eggs and embryos. We have a 24/7 alarm monitoring system, which is continuously taking temperature readings of the incubators as well as the dewars which have got your saved or frozen eggs or embryos. And I'm going to show you this room now, which is what we call the vault, where your eggs and embryos are stored in liquid nitrogen. So you can come through. This is my office, and this is where I see patients, and it's another consulting room. And again, you can see that it's a very well lit room. There's plenty of space, and patients feel at ease and comfortable when they see their consultants at IVF London. We're very privileged to have very spacious rooms. It doesn't feel claustrophobic. It feels like you are genuinely in a very nice setup whereby there's plenty of opportunity and space to spend time and ask your questions and get your consultants to be involved meticulously in the care that you truly deserve. So I'm going to now show you the room, which is what we call the vault. You may hear some very loud background noise, and in this room you can see we have aluminium flooring. That is because there is liquid nitrogen that is being kept in this room. And these are the containers that contain the liquid nitrogen. Liquid nitrogen is stored at minus 196 degrees centigrade. It's extremely cold. So it can create burns. There is health hazards if staff that are trained to be handling liquid nitrogen are not skilled. So it's very important that the training is given to the teams, and of course that there is adequate storage as well for liquid nitrogen. These are the dewars that we store the eggs and embryos in, and all these dewars are full of liquid nitrogen. The system that I was talking to you a bit earlier on, which is the alarm monitoring system, these are the alarm levels that we have, and these alarm systems are taking temperature readings of the liquid nitrogen in there every 5 minutes. And whenever the temperature rises, or say if the liquid nitrogen level drops, this will send a text a phone call to the 7 people who are what we call on the autodialer system. So it doesn't matter what time of day or what time of night, if the levels go down, and this is where your precious material is stored, this alarm system will activate, and there is 7 people on that autodialer system who can be contacted by the autodialer. Hence, we're able to attend to any emergency leading to the storage of eggs and embryos. So this is the room in which all those cryopreserved embryos or frozen eggs and embryos are kept, and these are kept safe at all times, simply because we have the monitoring system that looks and protects after your frozen samples, which are extremely precious, and we understand how important they are, but we keep them very safe, and you can see how. So thank you so much for your time today. I hope I've given you a good insight into the facilities at IVF London. You have been able to see the practices that we deliver here, and hopefully you've got some further information to make the right choice in choosing the right IVF clinic. Thank you.